Hello, friends. In this session, we'll be doing a quick recap of the topics which are being asked in your exam, and we'll be focusing on the INI-CET exam, which was conducted last year in November, December, and it will give you a good idea of the mix of the topics which are being asked in the exam. Moreover, if you attend one of our sessions which we are likely to have for review of the Aims exams in the previous year, so that will give you a much better picture of what are the topics which are the focus areas in the INI-CET and the Aims exam which is being asked. So let's quickly take a look at the topics and questions. These questions are similar to what were likely asked in the INI-CET. We don't have the exact questions because the questions and the paper is not given to the students. So this is based on discussion with the students that what are the likely topics which were asked in the exam. Exact question, obviously, the students will not be telling, but based on that, we have reconstructed a likely set of questions, and we are going to discuss that based on the topics given to us. Okay, so let's quickly take a look at some of these important topics. Well, for the last few years, we have been repeatedly seeing the question on the DNA methylation and its effect. Okay, so in this context, one thing you have to remember, and the only only covalent change which occurs in the DNA is methylation. So this point you have to remember. In the DNA, the only covalent change which can occur is methylation. If in any given question some of the options say that okay, there is phosphorylation of the DNA or there is acetylation of the DNA, then that is not correct. And in the DNA, only change which can occur is methylation. Second point you have to remember is whenever the DNA methylation occurs, and if this segment of gene is either a regulatory element or if it is a gene segment, in that case DNA methylation commonly results in silencing, right? It commonly results in silencing. Second point you have to keep in mind that the DNA methylation keeps occurring slowly and gradually inside the DNA during the lifetime of a cell. And that is why when the cell divides and when we are going to make the new DNA doesn't have the methylation, the older DNA has the methylation. So methylation is also used to distinguish between new and old strands. This is particularly important for repair immediately after replication. Okay, so these are the points which you have to remember. The silencing occurs if DNA methylation occurs within the gene segment or in the regulatory elements. The DNA, because it keeps getting methylated during the lifetime of a cell, after cell division, immediately when the new DNA is formed, the new DNA will have very little methylation. It occurs in the course of the lifetime of a cell. The old DNA will be having more of the methylation. So this can be used to distinguish between the new and the old strands. These 2 points you have to remember. Okay, so now let us look at the question. DNA methylation is involved in all except chromatin remodeling, RNA splicing, gene silencing, and base excision repair. Okay, now like I told you, the remodeling is occurring throughout the lifetime of a cell, and it will involve the DNA methylation. Okay, RNA splicing can be regulated. It is a regulatory function. It can be regulated by the methylation of the DNA. And same way, the gene splicing is also dependent on the DNA methylation. Gene silencing is dependent on the DNA methylation. I told you that methylation will cause the silencing. When you go to the repair mechanisms, most of the repair mechanisms are dependent on identifying the new and the old strand. The only exception here is the base excision repair. Why? Because here abnormal base is being formed. It can be there in the new strand, it can be there in the old strand, doesn't matter. What is important is the formation of the abnormal base. For example, there is spontaneous conversion of cytosine into the uracil. Now you can see this uracil is not supposed to be present in the DNA. So if you find uracil in the DNA, whether it is in the new strand or the old strand, it is abnormal, and the base exchange repair will focus on the presence of the uracil. Okay, it doesn't need to identify the new or the old strand. Rarely, you can also have the conversion of adenine into the hypoxanthine. Again, the hypoxanthine is not found in the DNA. It can sometimes be found in the transfer RNA, but the hypoxanthine is not found in the DNA. So presence of these abnormal bases is repaired by the base accession repair, and this repair mechanism is therefore independent of the DNA methylation. All right, the two important repair mechanisms which require DNA methylation to be completed is first the mismatch repair, and second is the nucleotide excision repair. These two will specifically require the DNA methylation, because this DNA methylation will be used to distinguish between which is going to be the template strand, where the correction has to be made. That has to be identified by distinguishing between the old and the new strand, for which the DNA methylation is used. So remember, for mismatch repair and nucleotide exchange repair, we will require the DNA methylation. For base exchange repair, the methylation is not required. The mismatch repair is sometimes written as MMR. The nucleotide exchange repair is written as NER, and the base exchange repair is written as the BER. So if the short forms are written, then also you should be able to answer this question. Okay. Next, again, nowadays we are seeing a lot of questions on the telomerase. Almost every year we are getting at least one question on the telomerase. So I'll briefly talk about telomerase, and then we'll come back to this question. Okay, so the telomerase is very important for the end of the DNA. So about telomerase, what all you have to remember. The first thing about telomerase, what is the primary function of the telomerase, what it exactly does. So telomerase elongates the telomere on old DNA strand at the end of replication. At the end of replication, the telomere, which is the end of DNA, will be elongated by the action of the telomerase. Second point which you have to remember is that telomerase is active only in certain cells. It is not having significant activity in majority of the cells, but in certain cells it is mainly active. So which are the tissues where we find that the telomerase is active? So in this context, you have to remember, first of all, the stem cells. Most commonly, you will find the stem cells in the hematopoietic tissue. So the common example is the hematopoietic stem cells. But it can be any stem cells. Nowadays, we have the concept of the cardiac stem cells, we have the concept of the neural crest stem cells, we have the concept of the hepatic stem cells. So the stem cells, where they can be present anywhere, they will have the active telomerase. Similarly, in the hair follicles, we find certain stem cells which can keep giving rise to the new and more cells. Then you can have the stem cells active in the male germline. Remember, in the female are born with a full complement of oocytes. New oocyte formation doesn't occur during the lifetime, so meiosis doesn't occur in large amount in the female. But in the male, continuous the spermiogenesis is taking place, and for that we require the telomerase. And similarly, we have the epithelium. Epithelium of skin, GIT. They are continuously getting recycled throughout the lifetime, so they will definitely have the telomerase. One important point to remember here is telomerase is also found active in the cancer cells. About 50 to 60% of the cancer cells will have the active telomerase. Okay, so this is second part about telomerase. You have to remember the tissues where it is active. Okay, and third part, you have to look at the structure and function. Okay, you have to look at structure and function. So when you talk about the structure, or you can say the composition, you'll find two very important things. First, what is known as TERC. TERC stands for the telomerase RNA copy or the complement. Okay, telomerase RNA copy. So when you examine this telomerase, what you find, this RNA copy is complementary. It is complementary to the characteristic telomere sequence. This is very, very important. So TRC, the telomerase RNA copy, is complementary to the telomere sequence. And second is what is known as TERT. TERT stands for telomerase reverse transcriptase. Now, what do you mean by reverse transcriptase? I'm sure most of you know what is reverse transcriptase. Reverse transcriptase is RNA dependent DNA polymerase. See, when we say DNA polymerase, it is basically DNA dependent DNA polymerase. It uses a DNA strand as a template and creates a new DNA. When we say RNA polymerase, it is a DNA dependent RNA polymerase. It uses a DNA and creates a RNA copy. But when we say reverse transcriptase, what is happening here? The RNA is now used as a template, and using this RNA as a template, the complementary DNA strand is synthesized. That is why the name is RNA dependent. The template in this case will be the RNA, and from this template we are going to synthesize or polymerize the DNA. So RNA dependent DNA polymerase, that is the reverse transcriptase. Obviously, in addition to these two proteins, there are a large number of other proteins, but the vital function is performed by these two molecules. The others are having the assisting role. Okay, so what is happening here? Let's say this is the parent strand. This is the parent strand, and at the end of replication, what we find that the new DNA strand is shorter than the parent strand. Alright, we have discussed this. When you do the process of replication, you find that the new DNA strand is shorter than the parent strand, because of which there is shortening of the telomere after every replication. That is how the shortening is occurring. Now, when the telomerase complex comes in, the RNA which is there in the telomerase, the TERC, will align itself like this. Remember, it is complementary to the telomere sequence, so it is able to form the base pairing. In addition to that, a small segment of the RNA is projecting forwards. Using this part of the RNA which is projecting forwards, the reverse transcriptase uses it as a template and adds the complementary nucleotides. Alright, it adds the complementary nucleotides. So what is happening here? The reverse transcription is happening. Using RNA, we are making the DNA. So the points you have to note: first, the telomerase acts on the old DNA strand, not on the new DNA strand. All right. Number one, it acts on the old DNA strand. Number two, elongation occurs at the 3' end. Always the new DNA will be synthesized at the 3' end. Even the RNA will be synthesized at the 3' end. So here also the elongation is occurring at the 3' end of the old DNA strand, sometimes also known as the parent DNA strand. Okay, so depending on the question, you have to identify. The telomerase will elongate the telomere at the 3' end of the old DNA strand or the parent strand by the reverse transcription. Okay, and this process is repeated a few times. Once it is particularly elongated during the next cycle, or even in that particular cycle, the further extension of the new DNA can occur. So these are some of the highlights about telomerase which you have to remember. First point, we said it elongates the telomere on the old DNA strand at end of replication. Okay. Then we said it is active in certain tissues. We highlighted tissues where it is active. Then we talked about the composition. We said two very important components are TERC and TERT in addition to the various other multiple proteins. And then we saw how it is functioning. Ultimate effect of the telomerase is it causes the elongation at 3' end of the old or the parent DNA strand at the end of replication. Now let us go back to the question. All are true regarding telomerase except it has reverse transcription activity. True. It is found in eukaryote. This is again true. Reason being, in the prokaryotes, because we have the circular DNA, the loss of telomere doesn't occur. So the telomerase is not required when we have the circular DNA. It will be required only when you have the linear DNA. Okay, see what is happening in case of the circular DNA. All right, in case of circular DNA, the replication proceeds simultaneously in both the directions and they complement each other. There is no loss of DNA, there is no loss of the end of DNA. So the telomere is not required, telomerase is not required in the prokaryotes. It maintains chromosome length, this is correct, but it doesn't maintain the fidelity. It is not maintaining the fidelity. Remember, the telomere doesn't have any gene. It is the constitutive heterochromatin. It is not responsible for the gene transcription and translation. So it is not actually maintaining the DNA fidelity. It is only extending the telomere. Okay, so it maintains the chromosome length. It is found in the eukaryotes. It has reverse transcriptive activity, but it doesn't maintain the DNA fidelity. Okay, remember this point. Okay, moving on to question number 3. Now again, very frequently nowadays we are getting the question on gluconeogenesis or the comparison between gluconeogenesis and the glycolysis. They are somewhat reciprocal pathways. One is carrying out the degradation of the glucose, second is carrying out the synthesis of the glucose from the non-carbohydrate sources. A lot of reactions are also common, but when we examine them, we find certain reactions of glycolysis which are irreversible have to be bypassed with the use of different enzymes. So most of our questions are focused on the irreversible reactions of glycolysis and how we bypass them in the gluconeogenesis. So let's look at that and then we'll come back to this question. Other enzymes of glycolysis and gluconeogenesis are common. They are catalyzed by reversible enzymes, mean they are catalyzing both the forward and the backward reaction. So we don't require them uniquely for glycolysis or gluconeogenesis. Same enzyme is catalyzing the reaction in both the directions. So take a look at enzymes present exclusively in glycolysis and enzymes exclusively present in the gluconeogenesis. The first irreversible reaction in glycolysis is catalyzed by hexokinase or the glucokinase. The reaction number 3, which is the second irreversible reaction, is catalyzed by the phosphofructokinase. Here what is happening? Conversion of fructose 6-phosphate to the fructose 1,6-bisphosphate. And lastly, the reaction number 10, where the pyruvate is generated from the phosphoryl pyruvate by reaction of pyruvate kinase, is the third irreversible reaction in the glycolysis, and these enzymes will catalyze those reactions. When we say irreversible reaction, what this means, the backward reaction cannot be catalyzed by the same enzyme. Okay, so 1, 2, and 3 enzymes catalyzing the irreversible reaction, their activity has to be bypassed when you are doing the gluconeogenesis. So the activity of pyruvate kinase is bypassed using 2 enzymes. First, the pyruvate carboxylase. What it does, it converts the pyruvate. It converts the pyruvate into the oxaloacetate. So first enzyme, the pyruvate carboxylase, converts pyruvate into oxaloacetate. This oxaloacetate is then converted into the phosphoenol pyruvate by the action of phosphoenol pyruvate carboxykinase. So these 2 enzymes will together bypass the action of pyruvate kinase. In pyruvate kinase action, what is happening? The phosphoenol pyruvate is converted into the pyruvate. Okay, and what we have done now, we have converted the pyruvate back to phosphoenol pyruvate. Please note, direct conversion of pyruvate to PEP cannot occur. It goes through a complicated route by which the pyruvate is first converted to oxaloacetate and ultimately to the phosphoenol pyruvate. Moving on to the PFK1 action, what it is doing, it is converting fructose 6-phosphate to fructose 1,6-bisphosphate, and this is bypassed using the fructose 1,6 bisphosphatase. Okay, so phosphatase will release the free inorganic phosphate, so no capture of the high energy phosphate will take place. And lastly, here what is happening, the fructose 1,6 bisphosphate is converted into the fructose 6 phosphate, right? This is the action of fructose 1,6 bisphosphatase. And lastly, the action of glucose 6 phosphatase should be very, very obvious. Glucose 6 phosphate is converted into the glucose. The phosphatase will release the phosphate as the free inorganic phosphate, will not be trapped. So you can note the enzymes unique for gluconeogenesis are pyruvate carboxylase, the phosphoryl pyruvate carboxykinase, commonly written as PEPCK, the fructose 1,6 bisphosphatase, and the glucose 6 phosphatase. Let's go back to the question. Pyruvate kinase is for glycolysis, we just saw. The PEP carboxykinase is for gluconeogenesis, we just saw. The pyruvate carboxylase is also unique for gluconeogenesis. Hexokinase, the glucokinase or hexokinase part of the glycolysis. So 2 and 3 are enzymes involved in gluconeogenesis. Therefore, our answer should be option B. 2 and 3 are the enzymes involved in the gluconeogenesis. Let's go to question number 4. Again, nowadays we are seeing a lot of questions from nutrition, from the vitamins. So one such question is, the thermic effect of food is highest for, you know, this thermic effect by some other name. We commonly call it the SDA, or the specific dynamic action. Basically, in very simple terms, what do you mean by SDA? SDA is the amount of additional energy which is required to metabolize a foodstuff. Okay, and we describe this amount of energy in terms of percentage of the energy content of that food. Okay, so when we talk about the protein, the SDA, also known as the thermic effect of food, is about 20 to 30% of the calorific value of the food. For example, if you are consuming a food which is supposed to give you the 100 kilocalorie, okay, so from this 100 kilocalorie, approximately, let's say 30 kilocalorie will be used up, okay, for metabolizing the protein. As a result, your net gain will only be the 70 kilocalorie. Okay, that is why we say when you are consuming the proteins rather than more of the carbohydrates, your net gain of energy will be less for the same energy content of the food, for the same calorific value of the food, if it is having more protein, because the thermic effect of the protein or the specific dynamic action for protein is higher. Your gain from that food will be less in terms of the calories. Okay, for the fats, you can see the thermic effect is 11 to 13. Lowest thermic effect is for carbohydrate, meaning it is easiest to digest the carbohydrates. The thermic effect is barely 5%. In a mixed diet, where we have about 55 to 60% of the carbohydrates, about 20 to 30% of the protein, and 10 to 15% of the fats, the mixed diet will have the thermic effect of 10%. Why? Because majority of this food is the carbohydrate, so the final value is closer to the carbohydrate value, and about 10-15% coming from the fats. Okay, so you have to remember these points. The mixed diet will have the thermic effect of 10. The carbohydrate has the lowest thermic effect or the specific dynamic action, that is only 5%, followed by the fats, and finally the proteins. Proteins have very high specific dynamic action. They require a lot of energy for the successful metabolism of the proteins. So thermic effect of food is highest for the proteins. All right, remember, thermic effect of food is highest for the proteins. Okay, now for the last 3-4 years we have been seeing the question on the catalytic efficiency. All right, so you should know the definition of catalytic efficiency, or you can say the formula for catalytic efficiency. The catalytic efficiency is described by the two parameters Kcat and Km. I'm sure you know what are Kcat and Km. So by taking the ratio of Kcat and Km, we get the final value, that is the catalytic efficiency. Please note, in the numerator we have the Kcat, not in the denominator. In the denominator what we have is the Km. And as a concept, catalytic efficiency means how well an enzyme is working or how well it is performing the catalysis. Okay, so this is the catalytic efficiency. Now, the whenever you are taking the ratio and doing the comparison, you have to ensure that the units for all of them are the same. So you have to remember that the unit must be same when you're doing the calculation. Let's quickly do the calculation for 1, 2, 3, and 4, and then we'll compare the values that which is having the highest catalytic efficiency. For the option number 1, the value of kcat is 20 per second, and the value of km is 10 micromole. Okay, so we get the value of net value. I'm just doing the net value, that is 2. Okay, we get the net value of 2. Similarly, when we do the calculation for number 2, in number 2, what is happening? Make note, the kcat is 50. Kcat is 50. Km is given in nanomole. You have to convert this nanomole into the micromole. So 200 nanomole will be 0.2 micromole. And when you do the calculation will come out to 250. I'm not writing the unit here. Similarly, when you do the calculation for number 3, in case of number 3, the value of kcat is 200. The value of km is 2 micromole and your net value is 100. For number 4, the kcat is 200 and the km is 4. So your net value is 50. So now quickly do the comparison. 2, 250, 100 and 50. Which is the biggest number? The biggest number is 250. Therefore, the highest catalytic efficiency is seen for the option number 2. Please note, you have to read the units very, very carefully when you're doing the comparison. You cannot compare apples with oranges. When you're doing the comparison, that which apple is more juicy, then you must be comparing the two apples. Okay, you cannot compare the apples and the oranges. That what I mean is, always make sure that when you're doing the comparison, the units in the two values which are being compared is the same. If not, make sure you convert one of them in such a way that now the two comparators are having the equal units. Okay, so in this question, the trick point was one of the values was given in nanomole rather than the micromole. Otherwise, a very pretty straightforward question where you have to use the formula kcat by km. Again, I said in nutrition, very repeatedly we are getting questions on the vitamins, particularly the water soluble vitamins from the B complex. So here we got the question, in vitamin B12 deficiency, which of the following enzymes will be involved? So let us quickly take a look at the highlights for vitamin B12 and then let's come back to this question. Okay, vitamin B12 is required only for two enzymes, methylmalonyl coenzyme A mutase, also known as the isomerase, and the methionine synthase. These are the two enzymes which require the vitamin B12. Methylmalonyl coenzyme A can come from multiple sources, for example, in the catabolism of valine, for example, by carboxylation of propionyl coenzyme A. Okay, propionyl coenzyme A itself can come from various sources, from isoleucine, cholesterol, or the odd chain fatty acid. And directly from propionate, we can get the propionyl coenzyme A, which will then get converted into the methylmalonyl coenzyme A. Vitamin B12 is found only in food of animal origin. So the so-called vegans, which is pure vegetarian, who do not even consume the milk, have high risk of the B12 deficiency. In India, most of the vegetarians are consuming the milk and the curd. So the curd and the milk will have significant amount of B12, particularly the curd. Therefore, B12 deficiency is rare in Indian vegetarians. All right. To be very correct, the Indian vegetarians will be called the lacto-vegetarians. They are not vegans. They are lacto-vegetarian because we are consuming the products coming from milk. Milk is coming from the animal source. Okay. So they found in only of animal origin food. And vitamin B12 requires two very important components for absorption, which you have to remember. Cobalamin, which is secreted by the oral mucosa, or you can say the salivary glands. Meaning, if there is any damage in the secretion in the salivary glands in the mouth, the covalophyllin will not come out. Okay. So if there is any dehydrating disease where the secretion from the mouth is getting affected, then intrinsic factor is secreted from the gastric mucosa. So again, if the gastric mucosa is getting affected, the intrinsic factor will not be released, and therefore the absorption of B12 will not occur. For example, if you have the atrophic gastritis, in that case, the gastric epithelium mucosa is getting denuded, it is not getting synthesized properly, and intrinsic factor will not be released. These two are required to transport and help in the absorption of the vitamin B12. Please note, the absorption occurs only in the ileum. So if ileum is removed because of any reason, maybe there is trauma, maybe there is infection, because of which the ileum has been removed surgically, in that case again the B12 will not get absorbed. B12 contains cobalt. Okay. Second important point about vitamin B12 is the deficiency causes methylmalonic aciduria, the conversion of methylmalonyl coenzyme A to the succinyl coenzyme A. The methylmalonyl coenzyme A is getting converted into the succinyl coenzyme A, which requires the vitamin B12. So when there is B12 deficiency, the methylmalonyl coenzyme will accumulate, resulting in methylmalonic aciduria. All right. The very common cause of B12 deficiency is the defect in absorption, which is occurring only in the ileum. Typically, dietary deficiency is rare unless you are a very strict vegan. The dietary deficiency is very rare. B12 deficiency, as you know, results in pernicious anemia, which has two components. First is the megaloblastic anemia due to B9 deficiency, or you can say the folate trap. B12 is required for the recycling of B9. So when the B12 deficiency is there, the functional B9 deficiency also occurs. We call it the folate trap, which is responsible for the megaloblastic anemia. In addition, the methylation of arginine residue on the myelin basic protein, which is responsible for the myelination of the sheath, which is defective, and we will have the irreversible degeneration of the spinal cord. This is the pernicious part of the anemia. This is irreversible degeneration of the spinal cord. So again, in some cases, when you find the megaloblastic anemia and you supplement with B9 and you have not noticed that okay, B12 deficiency was there, whatever B12 is there will be diverted towards the recycling of the now excess of the B9, and the degeneration of spinal cord may be aggravated, meaning the neurological signs and symptoms may be aggravated if you give B9 supplementation in B12 deficiency. And a very characteristic finding in B12 deficiency is the knuckle pigmentation. Knuckle pigmentation is seen in the B12 deficiency. So if you find the anemia, along with that you find knuckle pigmentation, immediately you can think about the vitamin B12 deficiency. Now let us go back to the question. In B12 deficiency, which of the following enzymes will be involved? Methionine synthase, yes. Methylmalonyl coenzyme mutase or the isomerase, yes. Homocysteine synthase, no. Folate reductase, no. So answer should be 1 and 2. Answer should be 1 and 2. Okay. Moving on to question number 7. On the techniques, we are getting repeatedly more and more questions, but for this year and maybe next year, the very important technique which is definitely going to get asked is the polymerase chain reaction and its variants. Why? Because of this COVID pandemic, where the main modality for diagnosis was the reverse transcription PCR. So you must know the basics of the PCR, and the most basic thing in PCR is the steps. What are the steps of PCR and their sequence? Another important thing which you must know, that is the substrates which are required for the PCR. Let us quickly enumerate them. The substrates which are required for PCR: number 1, the template DNA for which the polymerase chain reaction is being performed. The markers which will identify which segment of DNA has to be amplified, that is the primers. The primers are always available in pairs. Then we should have the building blocks with which you are going to synthesize the new DNA, and you should have the enzyme which will synthesize the new DNA. Typically, the Taq polymerase is used. Now, for the polymerase enzyme, the cofactor magnesium is required, and whenever you are performing the reactions in a closed system, you must provide the buffer to ensure that the pH is maintained at a steady state and the reaction keeps on proceeding. Now, talking about the steps of PCR, important thing which you should remember is I generally describe what is known as step 0. When I say step 0, what this means, until unless you have completed this step, PCR is not possible. Okay. So what is step 0? See, we have to describe the segment of the DNA which has to be amplified, and for this you require the primers. Now, these primers cannot be picked up randomly. You have to specifically choose the segment which has to be amplified. Therefore, you must mark the beginning and the end of that segment. That is why what you have to do, first you have to design, and then you have to synthesize the primers. Until unless you carry out this, the PCR cannot be performed. Once you have the primers in hand, then first you separate the two strands of DNA. We call it the denaturation. After that, you allow the primers to attach to the complementary site. We call it the annealing. Once the annealing has occurred, the primer has to be extended by the Taq polymerase. We call it the extension step or the elongation step. Step 1, 2, and 3 make up one cycle, and 35 to 40 such cycles are required to complete the process of the polymerase chain reaction. Once the 35 to 40 cycles are completed, we have what is known as a final extension step, to make sure that incompletely formed DNA fragments are taken to the completion. Once all of this is achieved, the result of the polymerase chain reaction are visualized by commonly the DNA gel electrophoresis, where the gel is made up of agarose. Okay. So once you perform, the DNA results are visualized using the DNA gel electrophoresis, where we stain the gel using dyes, either ethylene bromide or the cyber green dye can be used. So please make note of the sequence of steps. Step 0, which is the synthesis and designing of the primer. 1 is denaturation, 2 is annealing, 3 is extension or the elongation. Extra points. Denaturation occurs at 90 to 94 degrees Celsius. It is a property of the DNA. More are the GC segments, closer it will be the 94. More are the 80 segments, closer it will be to the 90 value. Annealing typically occurs at the range of 45 to 65 degrees Celsius. This is a property of the primer. Again, if the primer has more GC content, the value will be closer to 65. It has more of 80 content, the value will be closer to the 45. The extension or elongation with the Taq polymerase occurs at 72 degrees Celsius. It is a property of the primer. So I'll highlight these points. The 72 degrees Celsius is a property of the enzyme. The temperature for annealing is a property of the primer. The denaturation temperature is a property of the template DNA. Meaning, if you change the enzyme for Taq, instead of Taq polymerase, you maybe use what is known as the BST polymerase. The BST polymerase has the optimum temperature at 45 degrees Celsius. You need not use the 72 degrees Celsius. You can perform the polymerization at 45 degrees Celsius. Let's go back to the question. Steps of a PCR. Hybridization. Without denaturation, you cannot do the hybridization. First, the two strands have to separate, only then the attachment will occur. Denaturation, annealing, elongation appears to be correct. Denaturation, first annealing, then elongation. Hybridization, no. First, there has to be the denaturation. So the correct answer is B. Denaturation followed by annealing, followed by the elongation. So question number 8 is based on the basic biochemistry, where we are talking about the displaceable ion in the solution, and for that we focus on the H plus ion or the OH ion. Okay, so displaceable ion in this case is H plus for HCl, and again H plus for the H2SO4. When you talk about normality, it will talk about the displaceable ions. So for the 2 millimole of HCl, the normality will be 2 millinormal. Okay. Whereas for 1 millimole of H2SO4 will get 2 ions per millimole of the H2SO4. This value will also be 2 millinormal. Why? Because 2 ions will be released from every molecule. So twice of 1 millimole is 2 millinormal, and again 2 millimole of 1 ion will be 2 millinormal. They are equal. So the normality of 2 millimole of HCl and 1 millimole of H2SO4 is going to be the same. It is not it will not be double. Okay, because we are counting the number of the replaceable or displaceable ions, which is H plus or OH minus. From the basics, we are repeatedly seeing the question on the respiratory quotient. So when you see the question on respiratory quotient, what you remember, the respiratory quotient is calculated by the very simple formula, where in the numerator you have to write the amount of CO2 which is getting eliminated. Typically the amount is described in milliliter. In the numerator, we will have the amount of oxygen which is getting consumed, again described in milliliter. Therefore, the ratio is just a numerical value. Okay, it is just a numerical value. And we have very well defined values for the different food stuff, which I'm sure you already know. For carbohydrates, the RQ is 1. For proteins, the RQ value is 0.8 to 0.9. For the fat, the RQ value is approximately 0.7. Now, two things to note. In case of anaerobic respiration, the value of O2 is 0. The value of O2 is 0 in case of anaerobic metabolism. So, when the denominator is 0, the overall value will become infinity. That is why the infinity value for anaerobic respiration. Second, alcohol has somewhat similar value to the beta hydroxybutyrate. It has one of the lowest RQ. Okay, low RQ means the high amount of energy will come out from that particular food substance. So the alcohol provides lot of energy on metabolism. It is one of the best lowest RQ values. Remember, these carbohydrate will have 1, the protein will have 0.8 to 0.9, the fat will have 0.7. If you have the mixed diet, typically the value is 0.8 to 0.85 for a mixed diet, where you have some amount of protein and the fat also. The value typically is 0.8 to 0.85. You have to choose one, then you will go with the 0.8. For mixed diet, the value will be 0.8, whereas for carbohydrate will be 1. So if it is a carbohydrate rich diet, then the value will be closer to 1. Okay, so if it is a carbohydrate poor diet, the value will be closer to that of the protein, which is similar to the mixed diet. Okay, so when you put the values here in the respiratory quotient for this particular question, what happens? The CO2 which is getting eliminated is about 200 ml. The O2 which is getting consumed is 250. You calculate it and the value comes out to 0.8. So answer to this question is 0.8. Okay, question number 10. We have somewhat seen this question already. See what is described. A patient present with pallor and cyanosis. Okay, this can happen in anemia. With the following presentation, you can see the pigmentation of the knuckles is there. Knuckle pigmentation along with the anemia will be characteristic for the vitamin B12 deficiency. We already said that knuckle pigmentation will be seen in the vitamin B12 deficiency. Okay, so this is a case of vitamin B12 deficiency. Now again, another question from the basics talking about the acid-base metabolism, where we have a concept known as anion gap. Alright, we have this concept known as anion gap. Basically, anion gap is the difference between the measured cations and the measured anions. Now, different books use different formula for anion gap. Sometimes the anion gap is described using only the sodium. In this case, the value is close to 12 milli equivalent per liter. Other books will consider, along with sodium, they will also consider the potassium, in which case the value is approximately 8 milli equivalent per liter. Okay, so depending on which formula is being used, you have to know the values 12 or the 8 milli equivalent per liter. The measured anions include the bicarbonate and the chloride. Now, there are various conditions, particularly when we talk about the metabolic acidosis, where large amount of acids are being produced. So in this case, the anion released from the acid is not getting measured. So always the blood will be neutral. But when you're doing the comparison of the anions and the cations, you find that the measured anions have decreased. Why? Because we are getting more and more anions from the acid. So to calibrate, the relative concentration of the measured anions will be less. The measured cations are mostly the sodium and the potassium. Even from acid, we are getting the H plus only. It is not a part of the measured cations. Okay, so the measured cations will be having the same value, but measured anion value falls. So the anion gap increases. So this typically occurs in the metabolic acidosis. So there are various conditions of metabolic acidosis where you find the increased anion gap. And this is something which you need to remember. How to remember the conditions of metabolic acidosis where the anion gap is increased? Very, very simple. We remember them using the mnemonic mud piles. Okay, this is the list of important disorders. Obviously, there can be other disorders besides this which can cause increased anion gap in case of metabolic acidosis, but these are the most important and the most common. M for methanol toxicity, U for uremia, D is for diabetic ketoacidosis, DKA, that is diabetic ketoacidosis, P is for paraldehyde, I is for isoniazid, also iron, L is for lactic acidosis, E is for ethanol toxicity, and S is for salicylates. Please note, in addition to ethanol, you can also add the ethylene glycol to this case. Okay, so these are some of the common conditions where, along with metabolic acidosis, you will find the increased anion gap. Now let us go back to the question. Diabetic ketoacidosis, yes. Lactic acidosis, yes. Salicylate poisoning, yes. In renal disorders, what is happening? There is loss of the cation as well as anion. Okay, so there the anion gap is not increased. Even if the acidosis is there, the anion gap is not increased. So the renal tubular acidosis will have the normal anion gap. The renal tubular acidosis will have the normal anion gaps. Remember this, in the metabolic acidosis, we can have either the renal tubular acidosis or the other causes where the new acids are being produced. When the new acids are being produced, there will have the increased anion gap. In renal tubular acidosis, the anion gap will be normal. Okay. Moving on to question number 12, it talks about the mechanism of ketosis which is occurring in type 1 diabetes mellitus. Now, when we say type 1 diabetes mellitus, what you have to understand that there is very low or no insulin. Alright, there is very low or no insulin. Result, the pathways which are normally down-regulated by insulin will be up-regulated. The pathways which are normally up-regulated by insulin will be down-regulated. So, like I tell in the class, what is the function of insulin? Insulin has twofold function. Number one, it decreases glucose. So, all the pathways which metabolize glucose will be up-regulated. The better way to write this will be, it increases glucose consumption. The insulin increases the glucose consumption, and when insulin is more, it means the glucose level is high, so the insulin decreases New fuel production. Now let us list what are the different pathways which fall under the two categories. The pathways whereby the glucose consumption is increased: glycolysis, the HMP shunt, the amino acid synthesis, the fatty acid synthesis, glycogen synthesis, cholesterol synthesis. All of this make use of glucose as the substrate, meaning these pathways will be upregulated. These pathways will be upregulated. On the other hand, the pathways whereby the new fuel is being produced: gluconeogenesis, the lipolysis, the glycogenolysis, and the ketogenesis. All of this will be down regulated. All right, all of this will be down regulated. Once you know this, let's go back to the question. In type 1 diabetes mellitus, what will happen? There will be increased mobilization of the free fatty acid from adipocyte. We said lipolysis is increasing. This is true. The acetyl coenzyme A entering the TCA cycle is decreased. This is also true. The increased synthesis of beta hydroxybutyrate. This is also true. And decreased beta oxidation of the fatty acid. Again, this is also partially true. But the question, please note, is talking about the ketosis. Which of these following steps is responsible for the ketosis? The factor which is predominantly responsible for ketosis is the increased mobilization of free fatty acid from the adipocyte. Why? Once the free fatty acid is released from adipocyte in the liver, it undergoes the metabolism. This is partially correct, not completely correct. So it undergoes metabolism in the liver and breakdown of the fatty acid occurs. But the hepatocytes will have limited NADH, and all of this fatty acid cannot be either completely broken down or entering the TCA cycle. So there is decreased entry of acetyl coenzyme A in the TCA cycle. So the intermediates are packaged into a product which is released for use by the rest of the body. So increased mobilization of free fatty acid is the most important reason for ketosis in the type 1 diabetes mellitus. Remember, the insulin normally inhibits the hormone sensitive lipase, which is responsible for the breakdown of the lipids in the adipocyte. So when insulin falls, this inhibition is lost and hormone sensitive lipase will become activated, which results in increased mobilization of the free fatty acid from the adipocyte. They'll go to the liver where they will get converted into the ketone bodies. So these are some of the very important basic fundamental topics which were asked in last year INI-CET. You can see the basics, the concepts, the fundamentals are being asked nowadays in the INI-CET. Clinical questions are mainly coming from the vitamins. We have seen the question from vitamins. We are getting even numericals from the enzymes. So this is the approach which is being utilized by the examiner in the current INI-CET pattern. I hope you will benefit from this revision of the INI-CET questions in the November 2020. If you have any doubts or queries, don't forget to ping us. Thank you very much. Take care and best of luck for your exam.